Welcome to South Coast Working, the voice of working people and those who continue to build the South Coast each and every day. From the docks to the mills to the classrooms to the roadways, working people add a voice and life to southeastern Massachusetts. Brought to you by the UMass Dartmouth Arnold M. Dubin Labor Education Center.
Time where the entire nation experienced an emergency lockdown, where do you even place your focus? Do you focus on yourself? Do you think about others? Is it possible to do both? Some may say, focus on yourself. For those working in healthcare, it wasn't that simple. They had no choice but to try to do both. Staying committed to their jobs, keeping themselves safe and their loved ones, was a round-the-clock priority. Through sickness and in health, unions are always there to fight for the protections of workers. However, this time, union workers did more than protect its working staff, they protected everyone. During the early days of COVID-19, when the virus was spreading faster by the day, it was imperative to find better ways to keep essential workers safe. There was a lot of focus on the spread of the virus in nursing homes, but very little talk on union work and seeing how they were being affected. The groundwork unions did for nursing homes impacted safety for the workers and the nursing home residents. In this episode of Union Strong in Nursing Homes, the Labor Education Center will be exploring the long-term effects unions had on different communities during the pandemic. To better understand the work and benefits unions provide, we will hear from Professor and author Adam Dean. We discovered in his article mortality rates from COVID-19 in nursing homes and connected with his mission to learn if unionized nursing homes had better mortality rates than non-unionized nursing homes.
So we started this project last spring, early on in the pandemic, when there was a sort of constant talk about essential workers and a sort of puzzle of how to keep essential workers safe and how important the spread of COVID-19 in the workplace might be. But there was very little talk at that point about labor unions playing a role in protecting workers at the workplace, and improving the safety of working conditions is one of the main things that labor unions have always fought for. So my co-authors and I started talking about how we might do a study to see whether or not unions were actually effective during the pandemic and really trying times in being able to successfully advocate for workers to make sure they had the things they need during the pandemic.
They decided to focus their study on the state of New York because it was the center of the pandemic in the early months in the U.S.
So that data was available from the state of New York, Department of Health, and then we worked with 1199 SEIU.
1199 SEIU is one of the largest unions representing healthcare workers and nursing homes in the country.
So we worked with them, and they gave us access to data on which nursing homes were unionized, and it's a relatively straightforward analysis to see if unionized nursing homes had fewer deaths or mortality rates from COVID-19 in the early weeks of the pandemic in New York. And as I imagine you and your readers may know, we found that unions were indeed associated with a decrease in mortality rates of about 30%, which was a pretty big finding.
This was a major discovery. The work unions were doing had a significant impact on the safety of the residents and members. The Labor Education Center asked recent grad and now surgical technician at Rhode Island Hospital, Terry Jari, about her thoughts on Professor Dean's article in the correlation to better outcomes for unionized nursing homes.
I was well aware of the lack of proper PPE for all healthcare services. However, I didn't consider the support of unions in the facilities as an asset at the time. Originally, I didn't really put nursing homes in the category of healthcare. dealing with this issue with PPE and pandemics and stuff like that. Maybe it's because I was overwhelmed in my own job in the operating room during this pandemic, but I'm glad I did get to read it, and I have learned a few things.
Non-unionized homes in the early days of the pandemic resulted in a higher number of infections and reports on staff members not having enough PPE.
Union nursing homes or union represented nursing homes had more licensed staff per resident. And they also had 30% less deaths from coronavirus than the non-unionized facilities. They had 13.8% relative rate increase in access to N95 masks and 7.3% relative increase in access to eye shields.
And access to N95 masks and eye shields played a huge part in not passing the virus person to person. Unions have been known for representing workers about fair wages and workers' rights, but they did more than that this year. Former nursing home worker and now vice president for 1199 SEIU, Herbert Jean-Baptiste, shares the early obstacles they faced during the pandemic and how they overcame them.
Into the pandemic, it's make it very difficult, how to communicate with our members. We were struggling to figure out how we're gonna communicate, how we're gonna get our message, to our members, especially we cannot go to their home, we cannot communicate, the only way we can communicate through the telephone. And then our members, working at their home, they cannot call us. They usually with all the PPE they have on, it's very difficult for them to pick up a phone to call us. So we have to figure out how we're gonna set up Zoom call, schedule team call to communicate with them, and then how we're gonna go to the parking lot to talk to our leaders to make sure that we get them the PPE.
If organizing meetings in parking lots is not a clear definition of pivoting, I don't know what is. It was great speaking with Herbert. He really helped me better understand the strength in unions. He referred to the staff members as leaders when he talked about them, and I thought that was incredible. Healthcare workers stepped up for all of us, while our leaders were inside working for us. Unions, they were outside working right along with them.
Every week, we were able to distribute 10,000 masks to our members. At first, it was a little bit difficult, but on the after 2 months, 3 months, during the pandemic, we were able to get masks to deliver to our members.
Getting masks delivered became difficult by the day. During the first weeks of the pandemic, healthcare workers were only issued 1 mask per week, but unions pushed to give members enough masks so they can change them out daily.
During the first week of the pandemic, management will give people one mask, and they have to wear that mask, to wear that mask for 1 week. So before they give them another mask. So we were able to go after management, make them do everything they can to give mask to our members on a weekly basis, on a daily basis, because we felt if you have a mask, it has to be on a weekly basis. If it's it's a COVID unit, and then you're gonna bring the COVID to your family because you're gonna have the mask.
In mortality rates from COVID-19 in nursing homes, it not only shows that unions were associated with better outcomes for nursing home residents, but the struggles unions led had effects that was much bigger than just the union members.
And one of the things that I think was really rewarding about this work for me and my co-authors, if I can speak on their behalf just a little bit, was to be able to demonstrate, for the union and for the workers there, that the work they were doing fighting for PPE and infection control policies really made a difference for the residents and for the broader community in general.
Without the proper PPE, they would have increased their chances of contracting the virus, and the union's priority was keeping members safe. The major difference between unionized nursing homes and non-unionized nursing homes is whether or not there is space being held to voice your concerns without consequences.
For nursing home workers in New York at the beginning of the pandemic, it was really obvious, at least from the people I spoke with who work in nursing homes or are members or leaders of the unions that represent those workers too, that it was really obvious to people on the ground what some of the most unsafe working conditions were and the things that had to change. And even though workers in any nursing home would have recognized that, it was the workers that had a union that felt safe and comfortable in approaching management to share those concerns or to even make demands for what needed to change.
And unions even managed to arrange a COVID pay.
We were able to get a differential, what you call a COVID pay for our members. Some nursing home, they were able to get up to $10 per hour for every hours they work on the top of their wages. It's more like a differential. It's extra money. They get every shift that they pick up. Usually they got another $100. So all those things we have to negotiate with management to make sure that people get compensated for the work that they have done. And then that encourage people to go to work.
Kim Wilson, director of the Dubin Labor Education Center, worked with Herbert in the past as representative for the precursor union of 1199 SEIU. She now works as a member of the steering committee of the Labor Education Center. The nursing home in New Bedford is owned by SEIU, so I asked for an update on the work they're doing.
New Bedford Nursing Home, it's a home been in the union for a long time. Before my time, before even I get to this country, New Bedford been in the union. This is a home that make a lot of work. We able to improve this home dramatically on wages. When I first come to work for the union, this nursing home, the starting rate, people was making $9-10 an hour. But I can tell you now, to these days, people making over $17 an hour. It's because of the work that we have done with the members and then with management.
Facilities without unions don't really have another option but to accept whatever management says. 2020 has proved things can change at any given moment. So it's important to establish systems where employees feel safe and heard.
I feel we haven't heard about this report is obvious to me is executives try to avoid unionizing because that means they have to invest more funds into the employees rather than into their profits and their pockets. I really enjoyed reading this article and hope to see more articles like it as we continue to try to overcome this pandemic. I think more information such as this should get out into the public rather than solely the information that the politicians and executives try to feed us.
Like Terry, I also enjoyed reading this article. Overall, unionized facilities have greater care towards their employees, so they're most likely to have better health all around. And when the health of everyone is safe, that has a positive effect on the rest of the community.
You often hear people say, oh, well, unions might increase wages or increase working conditions for unionized workers, but they're going to increase prices for other people, or they're going to increase unemployment somehow. And so there's often debates about whether or not the benefits of unions are really narrowly limited to the unions, or if they sort of bleed over to have a broader ripple effect or spillover effect for non-union workers. And here what we found was that, at least in nursing homes in New York, the unions were associated with better care, safer conditions for the residents. So it wasn't about protecting workers only. I mean, sort of the focus was on protecting workers, but the spillover directly was to increase the safety of the nursing homes for residents. And that obviously had, enormous benefits for the broader community that had their loved ones living in safer nursing homes.
When this business is to make everyone the family, the members, the employee, to make sure everyone get a piece of bread that they can go and then feed their loved one. When this business is to make our lives member better.
Protecting each other during good times and bad times goes a long way. Unionizing is much more than organizing. It's about joining together and remembering there is strength in numbers. I hope to see more facilities banding together to protect one another by unionizing. Thank you for listening to Union Strong in Nursing Homes. Before you leave, please click on the subscribe button below. This podcast is brought to you by the Arnold M. Dubin UMass Dartmouth Labor Education Center.